Live from the studios at KUSI News, inside San Diego.
The latest way to get liposuction, local dermatologist Kimberly Butterwick is here to show us laser lipo and how it works. Welcome back. There is a new, less invasive way to melt away the fat. It's called laser liposuction, and it has just been approved by the FDA. Dr. Kimberly Butterwick is here this morning from Spa MD to tell us all about it. Welcome.
Thank you. Thank you.
A new type of lipo. You know, a lot of people are going to be jumping on this. Tell us about it.
Well, the hope is that with this new laser, we can melt the fat underneath the skin and transmit some heat so the skin will shrink up and the fat will melt, and we'll be able to do liposuction almost without lipo.
So it really is a whole different way to take the fat out?
It's different, but right now it's used in very small amounts by itself. If you do a larger case, it needs to be combined with regular tumescent liposculpture, which is already a great procedure. People can be back at work in a day or two. But this new laser may help us get difficult to reach areas, refine the technique, smooth it a little bit more. So I'm looking forward to it.
Well, let's look at some before and afters, and we can talk about some of the candidates that would benefit from this new type of liposuction.
Great.
Here's a chin, a before and after of a woman who had it out of her chin.
Yes. And you can see the loose skin around her jowl and just underneath in the before picture. And afterwards, there's some excellent skin retraction. We can achieve this with tumescent liposculpture. That's a way with lots of fluid, but maybe this is a little bit better than we might get otherwise.
So maybe on facial areas, maybe on the kneecap and some small areas, this new type could be a more beneficial?
Yes, it could be. But we'll have to see. Just because it's new doesn't mean it's better. Now, it transmits some heat, so there may be an increased risk of burns, scars, or skin irregularities.
Things to definitely keep in mind.
Right.
Here's the next before and after on the outer thigh.
Right. That's a beautiful result. That, with the new laser alone, couldn't achieve that. I think that would need to be treated first with a laser and then with regular liposculpture. The laser goes underneath the skin and creates little tunnels, but that is beautiful skin retraction, a lovely natural result, and that's what we're always aiming for.
Now, the company and the big PR blitz on this is talking about less bruising, quicker recovery as we look at this before and after of a chin. Another pretty good result there.
Well, I think that what they're referring to is mainly what we have already with tumescent liposculpture. We can get minimal bruising. Patients can go back to work in a day or two already, but there still could be a little bruise, so that maybe we can get people back a day or two early. That would be wonderful. So it's new technology, it's intriguing. We'll have to see.
Right, yeah, I sense a little bit of an ambivalence about it. It's just kind of the newest thing, but just because something is new doesn't necessarily mean it's better.
That's exactly right, yes. And so I embrace new technology. We don't have, you know, it's always nice to try the new and best thing, but we have to do it conservatively, carefully, and so that's why we'll be studying this procedure in our office.
All right. It was just approved by the FDA last week. Do you expect a lot of San Diego offices doctors' offices to have it, embrace it?
Well, we'll see. I think most doctors kind of hold back. They don't jump right on the new technology. Wait and see till we make sure it's safe and effective.